I don't know if you can see me. Can you see me? Okay. Okay, thank you for the invitation for this very interesting workshop. So now I'm going to bring a little bit of the perspective from Latin America, some of the evidence that we have regarding transport and some health outcomes. So a little bit of context of the Latin American setting. So we know that Latin America is highly urbanized and unequal. 80% of the population of this region lives in urban areas, and 19 cities of the 30 most unequal cities in the world are in Latin America. Also, Latin America is characterized by being very dense, diverse, and fragmented. We also have problems with air pollution. Actually, our main cities, the largest cities, usually exceed WHO air quality guidelines. And in this graph, you see from our solar bulb project that we have a high variability on PM 2.5 annual mean annual average concentration of PM 2.5, but it's important to also underscore that 36% of these cities exceed WHO guidelines. We also have problems with congestion. Actually, 5 of the 20 most congested cities are in a region. And here in this graph, we have an indicator that we developed for our solar bulb project, which is called the Urban Travel Delay Index. And you also see a lot of variability on congestion. And for instance, here we have one of the cities that has more congestion, which is my city, the city of Bogota. Now, in the middle of this chaos that we have in Latin America and that some of us really embrace or have learned how to embrace, we also have innovative transportation policies and interventions that actually go beyond traditional systems. So the first one here is our BRT. The BRT system is the Bus Rapid Transit System, which is these type of buses with exclusive lanes and that were initially developed in Curitiba, Brazil. We also have the cable cars that originally they were for ski resorts, and in Latin America for the first time they were included as a transportation mode to reach these populations are very vulnerable, and it really connects this population with the mass transit. Also, we have the ciclovías, or the open street programs, which is this program in which main streets in many cities in Latin America are closed for cars at least 2 times per month, and they are open for individuals for leisure activities. And finally, the other policy that I want to underscore are the cycling policies. We've seen very interesting cycling policies in cities like Buenos Aires, Rosario, Santiago, with an important partnerships between private and public entities, and also with a lot of support from the community. So we also see that these programs are very much aligned with the new urban agenda, with SDG 11 and 3, and also have or could have an impact on the health of the individuals and also with the health of the environment or the planet. So the other interesting thing of these policies is that we have seen that they have a scale up, at least in the region of Latin America, and some of those also worldwide. So for instance, we have 55 cities with BRT in 13 countries, 8 cities with cable cars from 4 countries, 51 cities with exclusive infrastructure of cycling in 10 countries, and more than almost 250 cities with the Open Streets program in 16 countries. Now I'm going to provide a little bit of evidence of what we have from our BRT system and the cable car system that we are currently evaluating. So this is the map of the BRT in the world. So most of the BRTs are in Latin America and in Asia, but we see this type of transportation all over the world. And one of the largest BRTs, the BRT of the city of Bogota, that it's called TransMilenio. TransMilenio, it's run by a public entity, but all the operators of the buses and the fare collection company are private. So it's an example of public and private. 45% of the trips in Bogota, just to give you a context, are made by public transport. We have a city that is not car dependent. The average amount of passengers per day for the system is 2.4 million, and the average speed is 26 kilometers. And you wouldn't believe it, but this is the fastest mode that we have in the city. So now what evidence do we have regarding healthy behavior? So we conducted a study that for about 1,000 adults representative of the city of Bogota, and we assessed to what extent the users of TransMilenio were meeting or not meeting physical activity recommendations. We found that TransMilenio users are more likely to meet recommendations, and when we evaluated a subsample with accelerometry, we also see that the mean amount of MVPA, moderate to vigorous physical activity minutes, is higher for those who are users of the system when we compare that for those who are not users of the system. And the mean difference is of 12 minutes, which is very significant when we talk about physical activity. So now what's happening with TransMilenio? TransMilenio has 3 phases. These are the projected phases for the whole city. These, for instance, are the different old transportation system that needs to be changed just for one phase. So the question that we have is, are we going to continue walking when these changes occur in this very complex system? So to address that question for our policymakers, we conducted an agent-based model in which we assess and we simulated to what extent that could the new phases and the new changes in the transportation system could change walking behaviors. And what you observe in this graph is that, of course, when TransMilenio increases, we will expect higher minutes of walking, but we're going to reach a threshold. After that threshold, we're going to see a decrease on the minutes of walking. This threshold actually depends on 2 factors. One is the other modes of transportation, but also how apart the stations of TransMilenio are. And that threshold for Bogota is about 680 meters. And so our recommendation for the city of Bogota is to keep having those stations at least 6 meters apart if one of the effects for TransMilenio is related to healthy behaviors, in this case, walking. Another outcome that we have evaluated, and this is part of our Salurbal project with public transportation, is related with mental health. So we have here a study of 11 cities in Latin America, and we assess the association between congestion and depressive symptoms. And we found that the higher travel delay commute time is associated with more depressive symptoms. But this is modified by having a transit stop within 10 minutes. So those individuals who have a transit stop within 10 minutes walk are less likely to have depressive symptoms. The other thing that we found in this study is that users of formal transits, this being in Latin America, metro and BRT, and also some public transportation, are 4.8 times less likely to be screened positively for depression than those who are just drivers of cars. Now, from our qualitative evaluations using citizen science, and that is called Our Voice in the City, this is what we usually receive from our participants. They take pictures using the photo voice methodology, and they usually complain about our BRT because it's very congested, because it has air pollution. So this is a negative aspect that we really have with TransMilenio. So positive things for physical activity, negative things for congestion, another positive thing which is related with depressive symptoms. So that was for TransMilenio, but now we have a new transportation system that was inaugurated in 2018, which is run by the same company, TransMilenio, but also has a private operator. This is a cable. That the length of the cable is, can you go back? So the length of this cable is 3.43 kilometers. Currently, we have about 21,000 individuals per day using the system. And more importantly, this cable car is associated with urban projects. So we have renovation of the area. This area is among the poorest area in the city of Bogota. It's an informal settlement, and they have 16 projects related to parks, libraries, community centers, markets that we think are one of the most important part of the intervention of TransMilenio. So now within our Solurbal project, we are evaluating this TransMilenio, this mode of transportation, using a natural experiment. We have an intervention and a control group. We just finished baseline evaluation of in which we evaluated about 2,000 individuals. TransMilenio just started, and we're about to do the follow-up evaluation. Within the evaluation of TransMilenio, some of the outcomes are related to physical activity and air pollution. And here we have some results on the data that we are producing with physical activity. So we have here the trajectory of individuals. These are individuals whose main mode of transportation is public transportation plus walking. So 41% of those meet physical activity recommendations, and the mean MVPA is about 39 minutes. So our individuals who walk relatively high, and we are now evaluating to what extent those walking behaviors will change with the implementation of a new transportation system. And in this part of the map, you see the trajectories that we are evaluating through GPS of these individuals. Also related to air pollution, we are evaluating the inhaled dose. We are very much interested in what happened in those microenvironments of transport. These are the 4 main transportation systems that we see in the area of the cable car, and we are evaluating what's happening with concentrations of PM2.5, black carbon, and carbon monoxide. So what we have found in baseline is that the highest concentration, actually this is the calculated inhaled dose per minute, is higher in the feeder of the system, the feeder that goes to TransMilenio, which are the individuals who are more likely to now use the cable, which is an electric car. And more importantly, we also estimated the contribution of a typical round trip in the feeder and TransMilenio to the daily inhaled dose, which is estimated to be 80% for PM2.5, and this is for TransMilenio, 72% for black carbon, and 56% for carbon monoxide. So very high concentrations of inhaled doses that our participants are having when they use these transportation systems. So in summary, what have we learned from some of these transportation systems in Latin America? That they are innovative. They go beyond traditional systems. Here I just presented some evidence on what we have from 2 transportation systems. But we also think that they are very much aligned with SDG 11 and SDG 3, and we also think that can contribute to evidence for this new concept, this new framework of planetary health. Thank you. And just want to end with, this actually is a mural that we have in the cable car that shows the evolution of the transportation modes in the area. So it goes from the donkey, and this is in the 1975, so not a long time ago. And now it's moving to the cable car, which is an electric car. Thank you.